Obijiski. She is a wellness coach. And right here in Sedona, where I am as well, which is awesome. So welcome to the show, Susan.
Thank you. How are you this morning?
I'm doing great.
Good.
I'm starting to perk up. A lot of people, they feel like, okay, I'm going to go to the doctor and I'm going to do what my doctor says. And they don't talk about, your diet or, maybe you should change your exercise. They just talk about, okay, well, let's see what pills we can prescribe for you in order for you to feel less symptomatic in whatever it is that you're feeling. So how would somebody maybe get started in this?
Well, I think the first thing is kind of changing our mindset, especially in the United States. We are very aligned with modern medicine, which means that we go to the doctor with a symptom. That might be back pain, or it might be, perhaps it's depression. It could be anything, a rash, a skin rash. And that doctor is typically listening to and treating the symptom. So one of the things that we need to start looking at to get started with it is the mindset, is to look at everything that's going on. And we tend to kind of develop coping mechanisms over a period of time so that we're not really even thinking about the headaches or the things that we may already have thrown into the basket there and we may be already dealing with. We're just looking at that one symptom, going to the doctor. So the first mindset change I think you have to make is to really do some very careful and thoughtful analysis of what you do want to change, how you do feel, what's good, what's bad in your lifestyle, and those things that you are looking to improve or sustain as you get older. Because when you go to a regular doctor, as you said, they will typically be looking to give you drugs, or they might be doing surgery. For those people out there who have done something like go to a naturopath, or perhaps a traditional Chinese medical practitioner, what we know from comparing that to modern medicine is that our intake as metaphysical or wellness healers will always be much more comprehensive. So we will be asking a lot of questions about diet and nutrition and exercise and emotional stability. What is your job like? Are you under stress? Those kinds of intakes can take an hour or 2 hours to do, because we're asking all kinds of questions that we hope will give us a fuller picture. So changing our mindset as the patient or the client coming in is equally important, because what you demand from or expect from healthcare practitioners is pretty much what you're going to get. So you may need to think outside the box and go to more than one person. I'm not suggesting by any means that we not go to a medical doctor if we have a problem, but you can certainly consider complementary treatments and alternatives, and you would want to choose a medical doctor who's open to your doing that, so that they're not fighting you every step of the way.
So could somebody who has any type of problem see a holistic person like yourself? Or is it limited to just specific types of problems? Or how do you look at it that way?
So the door is open to everybody. What we will say is very much like what a chiropractor might say. If you come in to have a chiropractic treatment and they do a series of x-rays and they examine you, they may also suggest that you seek a particular type of specialist, like an orthopedic surgeon, or that you do physical therapy. So very much like that, when we're doing wellness coaching and practicing, if we don't have all the tools in our toolkit, we are at least expected to be familiar with all of those tools enough so that we can refer somebody to the appropriate people. So what may end up happening is that you may develop a team of people that you look to together as a team to be able to coach you and help you or treat you in some way to get you back to where you need to be. So it isn't always a one-person thing.
Okay, that makes sense. So people, can they expect to see results any faster, or What is the typical time frame for somebody to have a problem and then to see a result?
Well, I think it's like anything. Every one of us is different. And one of the principal factors of holism is looking at that uniqueness in the person. So if you're 20 years old or 18 years old and you go to someone with a problem, your body, mind, spirit may be in a position where it just needs a little bit of tweaking. There are a few things you can do, like perhaps not eating as much packaged food, or improving your diet, improving your sleep habits, learning a meditation technique to address issues. That may be a one-time thing. In that case, going out and making those changes should be relatively easy, and you should start to see results. For those of us that are older and have longstanding injuries or wellness issues, perhaps issues that are not actually going to be cured, if you will, but will be treated so that you can have the best quality of life possible. Those things may take a lot longer because it didn't take us 2 days to get that sick. It took us a long time. So it may take us a long time to get better. And this is probably a good time to mention the fact that what I often see, and I think a lot of holistic practitioners will say the same thing, is that we, especially in the US, we want to look for alternatives now. Alternative practices in medicine have become popular, but our mindset is still in the modern medicine world, if you will. So we go in saying, doctors are not really helping me, or I'm on medication, but I don't feel as good as I want to feel. And when you start talking about anything other than putting a pill in your mouth, people don't necessarily want to accept that responsibility to make themselves well. And what I've always said to people is, if you're not at least as concerned about your own well-being and health as I am, this is not going to work, because the changes that you need to make, we're not going to introduce them all at one time. If there are a myriad of problems, we're going to introduce them a little at a time so that you can improve, but you do need to commit to those changes. And if you don't, those things that you're complaining about are probably going to stay complaints.
Exactly. Yeah, it's like going back to the fingers. It's like you can't go to the doctor and have him, twist it back straight. It's
No.
It's got to come from inside of you.
And looking at the source is often a difficult thing. It may be a bit easier physically, but not always. Sometimes people have gotten multiple diagnoses, but emotionally or spiritually, it can certainly be very difficult to look inside. We're not taught to do that in our culture, and that's a whole other recommendation of training and education that somebody might take on, which is to learn more about how to do those things so that you can get your fingers straightened out or whatever it is that you're looking to do.
Right, exactly. So can we talk a little bit about maybe some general wellness tips that people who might be listening could start to implement?
Sure. Yeah, I think that one of the things that may be helpful, and certainly if I don't address what you're looking for, let me know after I finished it. But one of the things that might be helpful is, let's just look at a few things generally that somebody can do in the four prongs of holism. So if we're looking at something like physical, someone who has longstanding back problems, or someone who's under a lot of stress, someone who has an injury, you may be in the physical domain, you may be looking at things like massage therapy, sports massage, or specialized treatments like myofascial techniques, which engage the fascia in the body. Think of that as kind of a saran wrap that's underneath all of the skin over the muscles, and if that gets tightened or restricted, it can restrict motion. So you might be doing something like that. From a physical perspective, you might also be doing things like an exercise regimen for cardio health. You might be taking classes in martial arts to help your balance and your strength, your core strength. There's all kinds of different things that we would recommend specifically to what the person is capable of doing physically, including swimming, things like that. When we get into the other aspects of the physical domain, we would also be looking at nutrition. So one is to the extent possible, stop eating a lot of packaged and fast foods, start eating fresher things. So more vegetables, and I know that doctors will often tell you this too, but green vegetables, fruits. If you're eating meats, those meats should hopefully be grass-fed with no antibiotics. Those kinds of simple changes are going to be important to getting your body into a position where it can be as strong as possible. And people will often say when it comes to buying organic or healthy foods that it's more expensive, but it really isn't. It's about when you're eating, how much you're eating, what you're eating, and what you'll find is as you reduce a lot of things like lots of sugar and salt from your diet, you will, by your natural body's response, you will not be eating as much. And the foods that you're buying are probably not going to cost you more than the bulk of food you would be buying elsewhere. So for the
Right. And
physical,
if I was going to
that
say,
makes
and if it
sense.
keeps you from taking a pill too, it could really help. Like if you
Correct.
end up having to take a medicine that you wouldn't need to take from if you ate those natural foods, that could save you a ton of money right there.
It can. And one example of that is really many people are on things like Lipitor and things for high cholesterol. Prickly pear juice is readily available. If you don't live in Arizona, you can still get it. It can get shipped to you or to your local health food store if you want to ask them to order it. And it is, many people have heard of red rice yeast as a supplement for cholesterol, which works on some people, but not everyone. Prickly pear juice is, I have not found anyone yet that it doesn't work on. And all you really need is like an ounce of it, like a little jigger full every day. And you will start to see results within 2 to 3 months on your cholesterol. So things like that can be done without going to see someone. I'm not discouraging people from looking online, but it is good to get someone that can guide you a little bit just so that you're not grasping at straws, so that you're not floundering and trying everything that's out there and getting frustrated because it's not working for you.
Makes sense.
So from the mental perspective, we would be looking at things like meditation, additional education on brain retraining, which is really important as a coping mechanism for somebody who's had a traumatic brain injury, who might have been in the military or has had a car accident, that kind of thing. Learning breathing techniques that can also inform your physical health because you're getting your circulation going in a better way, but you're getting oxygen to your brain in that respect. There are things online that are great for the mental as well, things like Lumosity, which is a brain training kind of exercise thing you can do every day. And so those are things that we look to calm the mental aspect and focus you as well. In the emotional realm, we're asking questions about things like job stress and relationships. Are there changes that need to be made there? And those are things that only you can decide, but they may in fact be, and if you have a negative situation, they will certainly be affecting your health otherwise, physically and mentally and emotionally. So it's important to be honest about those things. You're probably going to want to try to get some counseling. If your health insurance does not cover therapy sessions, you can reach out to your county services. There are counselors that are available to talk to you about specific issues that may relate to family or relationships. Drug issues obviously are going to affect you across the board. So getting the right kind of counseling, I think, is important. We do a lot of breath work and guided imagery in the emotional realm, which also can affect the mental realm. So there, if you want to look out there online for things like guided imagery for a specific issue that you're experiencing, like stress or sleep issues, weight loss, any of those things, there are excellent CDs and downloads on those types of guided imagery meditations. And with frequent use, those things can begin to repattern your brain and your emotions. So that's an important thing as well. In the spiritual realm, If you are not religious, but you are a spiritual being, reading about religions and thought processes of spirituality in the world can help you to broaden your perspective. Also, just groups, free thinking groups and groups of people that get together and talk about philosophy and spirituality can help you to broaden your understanding. In this country, we often forget the spiritual aspect of ourselves, and whether it's religious or not, understanding what your perception of why we are here looks like, and how and why we interact with other people and what our obligations are to each other is important. So the spiritual aspect should also be explored. So those are kind of some generic things that we might be looking at. There are obviously very specific things we look to for people when we know what their issues are, but those are things everybody can give some thought to and begin to develop a plan, sit down and kind of align all four aspects, the physical, the mental, the emotional, and the spiritual, and write them down and say, what do I think my issues are in these areas? And then seek the appropriate help for whatever it is you think you need.
That sounds really great. So I love this advice because, this is so important, looking at all the different aspects of your being, because You're right, it's not just one thing. And what I like to tell people too is that there's a reason why you're having a problem.
Exactly.
It's not to beat you up or to punish you. It has nothing to do with that. It is trying to tell you something so that you can get better and be better than ever. So,
right. Yeah, and I'm glad you brought that up. I think that that's certainly a discussion for another day, because there's so much to that point that you just made. But it is important to understand that, because as we look at that holistic approach to our health, we want to do that with an eye toward being the best that we can be and improving our lives so that we can fulfill our purpose. But we don't want to do it with an attitude of being the patient or the victim, which is often the approach and the mindset that we've gotten into in this country, is that if you're sick, if you have a problem with a relationship, there's something wrong with you or with your approach to life. And that is not a mindset that's helpful when we're trying to make those kinds of changes. We need to do it with an attitude that says, this is something I'm learning from, this is something that has taught me, and I'm a better person for that.
Absolutely. And then a lot of times people end up teaching it to others. You look at people who are cancer survivors, and then they end up helping so many other people, get through that experience. So, so there are definitely good things that come out of bad situations. So,
And I would say that one of the things you want to think about too, if you're putting together a plan, is to be realistic about the challenges that you're going to face, because there will be things, whether it's self-discipline or people who are whether knowingly or unknowingly sort of getting in your way of accomplishing the goals because they're not pleased or they don't understand why you have to make these changes. So that might be for a relationship issue, or it could just be your friend wants to go to dinner at their favorite fast food place and you're not eating that food anymore. So they're maybe going to try to trip you up a little. So really being honest with yourself about the challenges and the issues. And to your point about helping other people, whether you're a cancer survivor or you're doing this, is surrounding yourself with a support network of people who have been through what you've been through, or just really want you to be the best you can be and are willing to help you, because you are going to have days where you feel like you're not making any progress. And that's just part of life, whether it's holistic, wellness plans we're putting in place, or I'm in a job and I thought I was doing great, and my manager calls me in and says, there are some ways that we should improve your performance. We all face those things. So when you're looking at these challenges and issues, if you're honest about them, you're going to anticipate them and be prepared.
Absolutely. So thank you. This has been really fun talking to you and talking about wellness.
You're welcome.
I love this topic.